Hello, welcome to a summary of posterior tibial tendon dysfunction brought to you by New York College of Podiatric Medicine. Posterior tibial tendon dysfunction is one of the most common problems of the foot, and it occurs when the posterior tibial tendon becomes inflamed. As a result, this tendon cannot provide stability for the foot and could result in flat foot, pain, and various other problems. There are 7 muscles in the posterior leg that are all innervated by the tibial nerve, branching off of the sciatic nerve, which are responsible for foot flexion. As a result, inflammation or rupture of the posterior tibial tendon will not prevent flexion, but rather cause discomfort of the foot. In addition, the inability of the tendon to provide adequate support results in flat-footedness. The tibialis posterior is a deep muscle of the posterior leg, which is responsible in assisting in plantar flexion. The posterior tibial tendon is the largest and most anterior of the medial ankle tendons. The posterior tibial tendon goes through the tarsal tunnel and connects to the navicular, cuneiform, cuboid, and metatarsals. Its main function is to maintain the longitudinal arch of the foot and to provide support while walking. Tendinitis can result from trauma, poor flexibility, or overuse during high-impact sports, where the tendon becomes inflamed or torn. Inflammation of the tendon can cause the longitudinal arch to collapse over time and show progressive weakening of the tendon. Obesity, diabetes, and hypertension can cause increased risk. Posterior tibial tendinitis is more commonly seen in women and in adults above the age of 40. Posterior tibial tendon cross-sectional area and thickness can be used to diagnose posterior tibial tendinitis and differentiate it from hypertrophy. Treatments include braces, orthotics, physical therapy, or surgery. Early diagnosis is important to prevent further injury. Taking an MRI of the ankle can be a very useful tool in deciding on the choice of treatment.
Hello, my name is Christian Elder, and I will be presenting our current understanding of posterior tibial tendon dysfunction. Treatment of posterior tibial tendon dysfunction, or PTD for short, is determined by its severity, which can be categorized into the following 5 stages. In the first stage, the patient will have mild tenosynovitis without any deformity of the foot. Tenosynovitis is the inflammation and swelling of the tendon, and in this instance, the posterior tibial tendon. The patient will be able to perform single heel raises, and the radiographs will appear normal. Treatment will include a walking boot for approximately 3 to 4 weeks, followed by physical therapy for 3 to 4 months. Following therapy, the patient may receive custom molded orthotics. In stage 2, the patient will display a collapsed arch on the radiograph, as well as losing the ability to perform a single heel raise. The patient will also display a flat foot deformity. Treatment for this stage is similar to stage 1, along with the surgical options being posterior tendon debridement and repair. Stage 2B is similar to stage 2A, except the patient will also show signs of talonavicular uncoverage on a radiograph, along with the too many toes sign present, as you can see here on this slide. Stage 3 radiographs show subtalar arthritis in the affected foot, as with rigid hindfoot valgus. Treatment for options for this stage include medial double orthodesis, triple orthodesis, and a possible deltoid ligament repair. Arthrodesis is the artificial joint ossification between two bones. Finally, stage 4 shows talar tilt due to the deltoid ligament becoming compromised, and the radiograph shows valgus deformity of the talus. At this stage, there are two treatment options available. Option 1 includes a triple arthrodesis with Achilles tendon lengthening, deltoid ligament reconstruction, and a total ankle arthroplasty with replacement. If the ankle deformity is reducible, then option 2 becomes available, which includes a medial double arthrodesis, once again, deltoid ligament reconstruction, and total ankle arthroplasty with replacement.
Hello, my name is George Bacco, and my section involves a surgical treatment for posterior tibial tendon dysfunction. As mentioned by my colleague Christian, toward the 4th stage of posterior tibial tendon dysfunction, the surgical procedure recommended is a total ankle arthroplasty replacement. Total ankle replacement is performed when the ankle deformity is reducible. The surgery itself takes about 2 hours. The surgeon will make a skin incision at the front of the ankle. The ends of the tibia and the talus bone will be removed, and then the bones will be replaced with a smooth metal surface and a high-density polyethylene plastic prosthetic. And the surgeon will suture back the incision. The goal of the surgery is to provide pain relief and to preserve the ankle motion so that the patient can have reduced pain when walking or performing activities. The pain management after surgery includes a combination of IV and oral narcotics to control the pain during post-op. Patients are usually admitted in the hospital and discharged once they're able to walk on crutches with reduced pain. The follow-up for the post-op visit with the surgeon will be about 2 weeks after surgery for removing the sutures. But the patient should still have their ankles protected with the surgical walking boot and to continue using crutches. 6 weeks after surgery, the surgeon will require an X-ray to decide the next plan of treatment. The patient will also be advised to attend physical therapy. Other surgical recommendations for posterior tibial tendon dysfunction includes a tibio-talocalcaneal arthrodesis, which involves bone infusion.
Good afternoon, my name is Chris Wallace, and I'm going to be going over the conclusion section for posterior tibial tendon dysfunction, or PTTD for short. My part consists of 3 separate parts, firstly being the main idea section, or the major takeaways, secondly being the future predictions, and lastly being the conclusion. So let's get into it. Some major takeaways to know for posterior tibial tendon itself is that it's innervated by the tibial nerve, which is a branch off the sciatic nerve. It has a function of being a medial longitudinal arch stabilizer, and the type of movement it performs is plantar flexion. In terms of the posterior tibial tendon dysfunction disorder, it's important to know that it's common in the population, and there's a higher frequency in women and adults over the age of 40. It's moderately difficult to identify because it's commonly misdiagnosed. And some risk factors to be aware of are having diabetes, being obese, or being overweight can contribute to this disorder because increased weight leads to increased pressure in the foot in general. For generalized treatment, braces, orthotics, and physical therapy is done that focus on rebuilding the arch support system of the foot. I added a picture to the right showing a normal foot with a normal medial longitudinal arch and a posterior tibial tendon dysfunction foot that has a fallen arch or a collapsed arch. In terms of future predictions for better outcomes of posterior tibial tendon dysfunction, everything listed on this slide can be correlated back to prevention. And when I say prevention, I'm also including stages 1 and 2. The reason is because both those stages don't require any surgical intervention. They just require having a walking boot and having physical therapy. And that's why it's so important to diagnose PTTD early on and also to treat it early on. A tool that's used for diagnosis presently is MRI, and it's predicted that better tools can help for earlier detection of PTTD and early diagnosis and also early treatment that would be beneficial overall for the outcomes of PTTD. In terms of the stages of posterior tibial tendon dysfunction, they are widely used among clinicians even today. However, scientifically, they haven't been studied all that much. So future research that focuses on studying the reliability, the accuracy of PTTD would have a better outcome for all. And because of the PTD stages not being studied all that much in the science community, there is a degree of subjectivity that doctors have with patients. So that allows for more of a case-by-case basis, and it allows doctors to have more freedom in treating their patients. And a follow-up for posterior tibial tendon dysfunction that would greatly help the outcomes of PTTD would be if any time that there is a suspicion of having PTTD, for there to be a referral to a team of doctors that specialize all in different things, and it would act as extra eyes that would help with misdiagnosis. In terms of the conclusion, the posterior tibial tendon is an important tendon that functions to connect calf muscles and muscles of the inner foot. Inflammation or rupture of the posterior tibial tendon can cause dysfunction in the arch support system of the foot. Over time, the posterior tibial tendon will eventually collapse, leading to the development of flat feet. In the later stages, deformities of the foot can be observed, such as talonavicular uncoverage, subtalar arthritis, and rigid hindfoot valgus. These deformities, if left untreated, can damage other stabilizers of the foot, such as the deltoid ligament, which would further contribute to the instability of the foot. Finally, it is clear the posterior tibial tendon plays a crucial role in supporting the arch support system in the foot, and dysfunction of this tendon leads to the development of flat feet, as well as a host of other podiatric deformities that in the later stages must be rectified surgically. Thank you for your time.